We've done, up until a couple of weeks ago, about 314 patients since 2011. We've had about almost 2% complications. We had 2 bruises on the brain as we went in, probably because we compromised a vein or something, but that resulted in no permanent problem. We had 1 case that had some swelling around the electrode that resolved. We don't know what caused that. No infection there. We only had 2 infections, that's less than 1%, and one of the problems we see, particularly in older patients, is some of these generators, after they've been in for a while, can erode through the skin. A year, 2, 3 years out after implantation. So that's a hard thing to avoid, but we've had 1 of those. We've had no deaths. In terms of accuracy, these numbers here probably don't mean much to you, but these are the best numbers ever been reported. These are 1.5 millimeter accuracy. The electrode itself is 1.25 millimeters in diameter. So we're basically have an error that's about the same as the width of the electrode. And we know that 2 millimeter area that I talked about, as long as we're within that, we're fine. One thing that we've found, and is always brought up, this is a little technical, but is that in the awake patients, we would see air get into the head. The covering of the brain was open for a long period of time during the microelectrode recording, which means air seeps into the head, spinal fluid leaks out, and the brain starts to subside. It starts to settle backwards slightly, which means now your targets are off. We don't see that anymore. We almost never see air in the head because we only have the covering the brain open for about 2 minutes. So that problem disappeared of air in the head and brain shift. I guess I'd say I'm sort of a pariah right now in the movement disorder surgery area because all these people I trained for 20 years are coming at me saying, why are you now doing it? You're doing it completely different. And now I have all these skills that are going to become useless. You know, how can you do that to me? Well, because it's better for patients. That's the answer. And they say, well, you can't have the same outcomes that we do. You can't have the same results that we have because you're just doing it so simply here and so quickly. I said, well, yeah, we do. So Dr. Brodsky and his group, I had nothing to do with this, looked at the outcomes, compared our outcomes currently to that big cooperative trial I talked about. And there's no difference. No difference in UPDRS scales, and it's kind of up and down, but all over the place, but basically no statistical difference between using microelectrodes, which we did in my center by me, and doing it this way, my center by me, with a sleep DBS. So that is the gut punch, I think, to anybody that thinks this is not viable.